First come, Captain Condoms. Those sticky shields are like tiny suits of armor for your, well, you know. They block sperm from reaching the egg, kind of like bouncers at a super exclusive party. Super easy to use. Don't forget to squeeze the upper part before rolling it on. They're 98% effective in saving you from babies, and are accessible. They can fit in your wallet or purse easier than that awkward high school dance photo. The best part? They save you from STIs like chlamydia, trichomonas, and gonorrhea with 98% effectiveness. But you must use the double whammy the right way. Otherwise, they'll be only 87% effective. Number 2. Birth control pills. These are tiny hormonal pills that control the crazy baby makers, but in another way. Eat one pill daily, like your vitamins, and tell your ovaries to take a vacation from egg-dropping duty. Not only this, the release of hormones will thicken the cervical mucus to block the sperm's way to the egg. What will happen then? In the first place, no sperm will enter the uterus, and if it does, it'll only roam in the empty waiting room and leave without any embrace. No fertilization opportunity. Well done, baby stoppers. What's more, some pills can even lighten your period or zap cramps, like a mini health spa for your lady bits. Thinking about whether you should have them? They're actually 99% effective, yet 93% effective for common folks who forget to take them too. So, always be consistent with your pill, unlike that gym membership you never used. Yet, remember, although generally safe, they may affect you adversely if you're over 35, have diabetes or high blood pressure, history of blood clots, liver disease, cardiac disease, breast cancer, or endometrial cancer. Number 3. Intrauterine device. With an IUD, you can ditch pregnancy problems for up to 10 years. That's way longer than that carton of milk you forgot about in the fridge. This T-shaped ninja weapon with a string may be small, but has the power to keep those pesky sperms away from the dear egg. Unlike the pill, which needs daily attention, set it correctly and forget it. With their 99% effectiveness, IUDs come in 2 types. Made to last for 10 years, the copper coil makes it harder for sperms to survive by causing mild inflammation in your uterus. And, with an effective duration of 8 years, the hormonal IUD is a progesterone boost to your body. It blocks the tiny swimmers by thickening the mucus in the cervix. As for long-term benefits, it lowers the risk for gynecological cancers, including cervical, endometrial, and ovarian cancer. But before strapping on this party crasher, discuss with your doctor to see if it's the right fit for you. Why? It's because they may affect you negatively if you're over 35, have diabetes, a history of blood clots, or cardiac disease. Plus, slipping of an IUD from the uterus and perforation in the uterus or cervix can also happen. So, talk to your doctor first to know the risk factors and stay in touch after getting the IUD. Number 4. Injectable contraceptives. The injectable superhero shots of progestin hormone give your baby-making factory a chill pill with up to a 99% success ratio when used correctly. It's a one-time jab in your arm or bum with a hormone dose lasting 3 months. Yeah, it's a quarterly subscription to no-surprise pregnancy. It stops ovulation and makes it tough for sperm to reach the egg by thickening the cervical mucus. Sad part? You must stay away from the birth control shot if you have a history of blood clots, breast cancer, or cardiac disease, and be prepared for other side effects, like thinning of bones and depression as well. Number 5. Contraceptive implants. A tiny bodyguard with a 99% success rate can say, "Nope, not today," to any wandering sperm trying to enter your uterus for the whole 3 years. This tiny matchstick-sized bar is your implant hero, who rests under your arm's skin. It releases hormones there to put your eggs on hold, like a snooze button, and thickens cervical mucus to trouble the sperm's easy swim. So, it becomes difficult for sperms to win the egg lottery. Also, no need to remember a daily pill, unless you have an elephant's memory. Plus, it's reversible when you're ready for that baby shower. Just have it removed. Heads up, girls. Like most contraception methods, these implants also have side effects. Think twice before having them if you have any allergies, high blood pressure, diabetes, depression, blood clots, heart disease, stroke, liver disease, or excessive vaginal bleeding. Number 6. Contraceptive patch. Just like other contraceptives, the birth control patch is a mini hormone sticker on your skin. It releases progestin and estrogen, like some birth control pills, but don't need to remember them as pills. These hormones whisper to your body by saying, "Hey, ovulation party canceled." Plus, they thicken cervical mucus, making it tough for sperms to travel. People who use the contraceptive patch wear it for 3 weeks, then take a week off for their period. It's a patch vacation. Are you wondering how effective they are? Pretty darn good, like 99.7%, if you follow the replacement schedule and healthcare guidelines actively. The bonus part is that unlike pills you can miss, the patch keeps working even if you forget for a day or two. With some limits? Downside? It's not for everyone. The baby stopping patch is a big no if you have a history of blood clots, hypertension, heart disease, liver disease, diabetes, unexplained menstrual bleeding, and obesity. Number 7. Vaginal ring. You've got a tiny, flexible hula hoop for you down there. This flexible ring sits in your vagina and releases steady streams of hormones, like some birth control pills, to prevent pregnancy. It sends a gentle message to your ovaries. Don't release any eggs today. It thickens cervical mucus, making sperm feel like they're swimming through thick soup. There's only one main type of ring, and it works for 3 weeks straight. Yeah, it's a marathon compared to the pill's daily jog. Then, you take it out for a week, which usually brings on your period. Think of it as ring cleaning time. It's also 99% effective with perfect use, similar to the pill if you're a stickler for schedules. Bonus? No daily pill to remember. However, it might not be your jam if you have certain health conditions like blood clots, heart attack, and breast cancer. But for folks who forget pills or dislike daily routines, the ring is a champion. Number 8. Emergency contraception. Can you think of oops moments after a fun night? The horror of getting a baby without plans can be almost killing, at least for me. The second thought of an abortion may also haunt you too. Don't worry. Emergency contraception can give you another chance to avoid pregnancy after unsafe sex. They are of 2 types. First, the contraceptive pill, also known as EC or morning after pills, works as a safety net you can use after things get a little unplanned. They have a higher dose of hormones than regular birth control pills, which can temporarily put ovulation on hold or thicken cervical mucus to block sperm. In some cases, EC might also change the lining of the uterus, making it difficult for a fertilized egg to implant. However, it's most effective the sooner you take it, ideally within 3 to 5 days of sex. Second comes the copper IUD. Your doctor may insert it in your uterus when you rush to him with a fear of pregnancy soon after sex. Although this fun-size copper coil disrupts sperm's job after unsafe sex, it also stays there for the next several years. It's a win-win. Here's the thing. EC isn't as effective as regular birth control. It's over 75% effective the sooner you take it, going down from there. So, it may not be your main defense, but a prevention only. Also, please don't confuse it with an abortion pill. Safety-wise, EC is good for most people, but it can mess with your monthly cycle a bit. So, talk to a doctor if you have any other concerns. Bonus part, EC is available over the counter for anyone, regardless of gender. Your partner can get it too, if needed. Compared to regular birth control, like the pill or patch, EC is less effective and meant for emergencies. Number 9. Sterilization. Say sayonara to baby making forever. Sterilization birth control is like snipping the microphone cord at karaoke night. For guys, there's vasectomy and tubal ligation for gals. For a vasectomy, you snip the highway that sperm travels on. No sperm, no pregnancy. Its 99% effectiveness is for a lifetime. Plus, it's a quick outpatient procedure. But the downside is there. Reversal is tricky. So, be sure you're ready to be a permanent conductor of your own family band. Tubal ligation puts a roadblock in the fallopian tubes, the egg highway. Those little guys won't be getting through. Again, it's extremely effective, over 99%, and long-lasting. But similar to a vasectomy, it's also permanent. Reversal is possible but not guaranteed. Just remember, it's a big decision, so talk to your doctor to see if it hits the right note for you. Thanks for hanging out with us today. Hit like if this video rocked, subscribe for more, and share the knowledge to your core.